Duragel Callus Removers 40% Topical Patch is a medication used on the skin to treat common skin and foot warts. It contains salicylic acid, which helps the wart to gradually peel off. This medication is also used to help remove corns and calluses. It should not be used on the face, moles, birthmarks, warts with hair growing from them, or genital/anal warts. Salicylic acid works by increasing the amount of moisture in the skin and dissolving the substance that causes the skin cells to stick together, making it easier to shed the skin cells. It does not affect the virus that causes warts. Make sure to follow the recommended dosage and apply the patch at the best time for your skin. When using Duragel Callus Removers 40% Topical Patch, it's important to follow the directions on the product package. This medication is only for use on the skin, so be careful to avoid getting it in your eyes, nose, mouth, groin, or on any broken skin. If contact does occur, flush the area with cool water for 15 minutes and wash your hands after use. Before applying the medication, soak the affected area in warm water for about 5 minutes to soften it, then dry thoroughly. Your doctor may recommend using a pumice stone, callus file, or emery board to remove the top dead layers of skin to help the medication work better, but do not try to rub the wart or callus off. If using a liquid or gel, apply a few drops or a thin coat to cover the entire area, being careful to apply it only to the affected area and not the surrounding skin. Let it dry for 5 minutes and repeat the application as directed on the product package, usually 1 to 2 times daily for up to 2 weeks for corns and calluses and 12 weeks for warts. If using a medicated pad or bandage, cut it to cover the treatment area completely but not touch the surrounding skin. Place the patch or bandage over the area according to package directions, and repeat the procedure for up to 2 weeks for corns and calluses and 12 weeks for warts. The dosage of this medication is based on your medical condition, product type/brand, and response to treatment, so be sure to follow the directions carefully. Use it regularly at the same time each day to get the most benefit from it. If your condition lasts or gets worse, or if you think you may have a serious medical problem, be sure to seek medical help right away. Some common side effects of using Duragel Callus Removers 40% Topical Patch include slight burning, skin redness, and peeling. These effects are normal and to be expected. However, if they become worse, it's important to speak with your doctor or pharmacist. If your doctor has recommended this medication for you, it's because they believe that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience any serious side effects. Be sure to inform your doctor immediately if you experience any serious side effects, such as spreading skin redness around the treated area, signs of infection, or the formation of a deep sore at the treatment site. While it's rare, a very serious allergic reaction to this medication can occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report them to Health Canada. Before using Duragel Callus Removers 40% Topical Patch, make sure to inform your doctor or pharmacist if you have any allergies to salicylic acid, NSAIDs, or any other inactive ingredients in the product. It's important to discuss your medical history, especially if you have diabetes, poor blood circulation, or any skin infections or irritations. If you are scheduled for an MRI test, let the testing personnel know that you are using the patch, as some patches may contain metals that can cause burns during the MRI. Your doctor can advise you on whether you need to remove the patch before the test and how to apply a new one afterwards. For pregnant women, this product should only be used when absolutely necessary, so make sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this product if you are breastfeeding, as it is unknown whether the drug passes into breast milk. When using Duragel Callus Removers 40% Topical Patch, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's essential to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Duragel Callus Removers 40% Topical Patch. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember, it's important to keep this medication out of reach of children and pets to prevent accidental ingestion. Always follow the instructions of your healthcare provider when using this medication. If your doctor has given you this medication, do not share it with anyone else. If you forget to use the patch, apply it as soon as you remember. If it's close to the time for your next dose, just wait and use the patch at your regular time. Don't use 2 patches to make up for the missed one. When storing Duragel Callus Removers 40% Topical Patch, make sure to keep it at room temperature. Different brands may have different storage requirements, so always refer to the product packaging or ask your pharmacist for specific instructions. It's important to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the patch when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.